I'm a local boy. I grew up here. Parents moved from India in the 60s to here, and then I grew up was born in East Norton, and then moved here in 8th grade. And then basically I'm a product of Richboro and Newtown area. Went to high school here, went to school at LaSalle University. I wanted to practice medicine a little bit different. I did my medicine clerkships and rotations, and there's something nice and intimate about that conversation when somebody sits there and they have something bothering them and you can talk to them about it. But then I went through residency and realized that there are a lot of limitations in terms of that time. You don't have much time with the patient. When I did my fellowship, and it was in geriatric medicine in Boston, we realized that things are much more complicated than they seem. So if somebody comes in complaining of a sore throat, there may be 7 other issues that are going on that need to be addressed. And so that kind of got me thinking in terms of different ways to build a practice, my own practice in my own hometown, where we can basically provide the best primary care, but in a way that allows us to do it so we're small and time intensive. The whole idea is basically it's a practice model that allows people to join, and we spend as much time as needed. And because of that freedom to where you don't have to worry about restrictions about seeing somebody every 10 minutes and 15 minutes, there's so much more that you can do. You can actually talk about somebody's health and not just deal with their sore ankle. Internal medicine is unique in that it deals with adult diseases. So things as straightforward as hypertension to hypercholesterolemia to more complicated issues where somebody may have 1, 2, or 3 of those conditions together. So we learn to manage them through lifestyle or medications, how to diagnose a condition as well as knowing how to treat a condition. After which I'm also board certified in geriatric medicine. I did that at Boston University because I realized that as people age, they become more complex. And I want to make sure that I'm highly trained in being able to care for people across the care continuum. So ages 18 to 99, ages 18 to currently my oldest patient is 103. And that's where signature medicine is unique. And that's the kind of practice that I want that's the practice of medicine that I actually want to do. And this is something I want to do for the next 50, 60 years. Basically, there is no retirement.